Next presentation is being led by the Chief Executive Officer of the Australian Digital Health Agency, Tim Kelsey. Let's give a warm welcome to Mr. Kelsey as he discusses how data and technology is being used to better the health and well-being of Australians. This is our last talk just before lunch, and he's from down under, so you don't want to miss it.
Thanks, everybody. Thank you particularly to colleagues at eMerge who arranged for this, for the Australian delegation. There are some fantastic companies in the exhibition to be here today, and obviously for me to have the honour of addressing the meeting about some of the work that's going on in Australia. You can tell I'm not personally Australian. In fact, I spent the last 10 years working for the British government on health and digital, and now my great privilege to work on those same things for the Australian government. So we're here today just to take you through a little bit of a story of where Australia's got to. And later this week, I'm actually in Washington to co-chair the second meeting of what we're calling the Global Digital Health Partnership. There are some people in the room familiar with that. And that's an expression of what I think everybody is in the room today to celebrate, which is the opportunity for global collaboration on making digital health work better for patients and citizens on our planet. And you think of parking, you think of some of the extraordinary achievements that have been made in developing city infrastructure using digital technology. I used to work on the Open Government Partnership, so much more broadly on bringing democratic functions to life through data sharing, and yet in healthcare we are behind the curve. We're behind the curve so that it makes it dangerous for people. We are at the moment in most countries of the world failing to ensure the safety of patients in healthcare because we are still in the age of paper-based healthcare. And in the background, the hum or the whir of the fax machine is the enemy of everything we hold dear in relation to clinical quality and outcomes and the patient experience. So in a sense, the talk I'm about to give is a talk about how we together should abolish the fax machine from clinical practice. And when we have done, we will know that we are providing safer, better healthcare for all our citizens. So Australia has an amazingly distinguished track record of invention. Everybody knows Australia is the biggest island in the world, that it's the driest continent, that it's, well, you may not know this, but it's number 6th largest country, only a little bit smaller than the United States. It has a vastly smaller population, so just 25 million Australians, largely living on the eastern seaboard of the country. But despite that relative smallness in terms of the human capital at the disposal of such a vast country, it has this tremendous history of innovation. And those are just some of the things you may not necessarily know. Australia was the home of Wi-Fi, for example. And I just say that because it makes it even more of an imperative for Australians that they take advantage of those great scientific skills and put them to work on getting the digital basics right in healthcare. Now, Australia today has one of the best healthcare services in the world. That's by common agreement across the world. In this particular review done by the Commonwealth Fund last year, Australia was said to be second behind the National Health Service where I used to work. I'm not really sure that that's necessarily true, but certainly Australia is one of the best countries in the world for health outcomes. Now, every Australian, though, knows just how much more work there is to do to improve the quality of services provided. So just looking here as a sort of, in a sense, today, tomorrow. So right now, in Australia, each year, around 220,000 hospital admissions are caused by adverse drug events. There are more deaths from medication misadventure in Australia than there are from road traffic accidents. 14% it says there. Actually, we think it might be up to 20% of diagnostic tests repeated, duplicated, because treating clinicians do not have access to a person's medical history. So really basic stuff, the flaws, as I say, of paper-based healthcare, where when you arrive to see your GP in the Australian context or your specialist, you are the only memory of your own treatment on many occasions. And indeed, some of the most famous hospitals in Australia are, at the end of your treatment, giving you a paper file to carry with you into your next care episode. So these are the causes, some of the causes of why we have still very continued variation and why still avoidable harm occurs to people in Australia, just as it does in the United States and elsewhere. But for Australia, this is a highly solvable issue, and the Australian government has now very firmly decided to put digital technology to use in just the same way as Miami is in terms of improving citizen experience of the city we're currently in. The vehicle for doing this is the Australian Digital Health Agency. So I have this enormous privilege of being the chief executive of the agency, and the agency is built on a lot of experience in Australia and also elsewhere of how things haven't gone right in digital health. So we all know that the promise of this has just not been delivered, as I say, in healthcare as much as perhaps it has been in the rest of our lives. And so Australia thought very deeply about what could be the sort of role of government as a platform in promoting innovation across the health ecosystem. So the first thing to say about this agency is that we are here to serve innovators in Australia and globally. And that's one of the reasons why we're at eMERGE today, both to encourage our own entrepreneurs to be able to showcase the work they're doing, but also to invite you as global entrepreneurs to think about Australia as a platform, a future market for your own work. So the agency runs national infrastructure, and I'm going to come back and talk a little bit about one of those pieces of national infrastructure which I think might be very interesting to you. But we do so as a servant of innovation. We have moved well beyond the idea that government somehow is here to dictate or to impose. This is about clinical leadership, it's about co-production with the community, and it's about service of those who are innovating in digital health. We spent our first couple of years, so we're a couple of years old, developing a new approach, a new call out for how we would collectively deliver on this opportunity of digital technology. And these are the 7 pillars of our strategy. So I'm not going to go through all of those today, but if you're interested, please do take a look at the strategy. It's available online on our website and just through a Google search. I would say that having just quickly walked around the exhibition, there are a number of very advanced applications out there relating to improved medicines management, for example. That is a major call out for the strategy in Australia. Australia intends to be the most advanced e-prescribing nation on earth in the next 2 years. We also aim to have fully interoperable health services in Australia using all current best practice in interoperability within the next 5 years. So setting an ambition which is globally ambitious, advanced, but I think Australia has a chance to get there. What I just wanted to talk about in the few minutes I have is this first priority in that strategy. So the My Health Record. Now, for every health system I've encountered and had the privilege of working with or for, the first aspiration has been to provide citizens with access to a secure, mobile, online clinical record. It's been the #1 call out for all nations, and that's because the evidence is really clear that if you do successfully create a summary care record, not a record of everything, but a record of the key items of clinical information that in an emergency will help save lives, or in the management of complex conditions will help improve coordination between clinicians. The call out here is that, and the evidence says that that single initiative by government will more than anything else reduce the costs of healthcare and improve their outcome. It is the first answer to dealing with the incidence of adverse drug events in clinical practice. And that's been evidenced everywhere. So question really is, why has no government yet given this to every single citizen who wants one? And Australia will be the first nation to do so. So by the end of this year, my message is, and I'm here to celebrate the fact that by the end of 2018, every Australian citizen will have access and even control of a personal health record which will contain all key items of clinical information. Now, it's taken a while to get to this point. So today, as you can see from this slide, 5 million Australians have a My Health record. By the end of this year, it'll move to opt-out registration, which means that unless you say you don't want one, you will be given a record. The trials that we've run involving more than 1 million people in Australia suggest that somewhere around 2% of the population may choose to opt out. And that underscores something I was just going to touch on at the end, which is that none of this is easy. And one of the reasons why people opt out is because of a perfectly legitimate distrust of the internet and a distrust more broadly perhaps of government itself. So here we have a My Health record going to opt out by the end of the year. This is the information it contains. So if you're an app developer, for example, looking to provide access to rich clinical content to your customers and to mash that up with content from other sources, whether that's a Fitbit or from other mobile data applications, this could be an interesting platform for you. We've now licensed the first 4 apps in Australia to be able to provide views of My Health record to customers who want it, and it's proving an extremely popular opportunity for the general public. So data flows not just from the clinical information systems in hospitals or general practice, but also from pathology, radiology, from all those services you can see, which will make My Health record the richest source of clinical information on its scale anywhere in the world. Next week, the Australian government will be publishing the framework for secondary uses of that data to support research and improvements in clinical benefit. But Australia, in one fell swoop, will have created both the single largest remedy for paper-based healthcare through the sharing of key information at this scale, and also will have created the richest database of its kind for secondary uses in healthcare. The benefits of My Health record are manifest. I hope that you, as I guess, digital natives will intuitively understand this, but it goes much beyond just the direct improvement of quality in healthcare and reduction in harm. It's also about the future sustainability of healthcare. And I just wanted to say here that one of the big challenges we have with our colleagues in other governments, and one of the reasons why we're meeting in Washington this week to talk about how we can share better our policy priorities, is because we want to make it easier for innovators in industry to be able to access our different markets with their services so they can operate at scale faster and bring innovation more quickly to citizens in all our countries. And we can't yet quite determine what level of benefit that will really bring citizens in Australia. But the belief and the investment that's being made by the Australian government is that if we can provide a platform for added value innovation by developers across the world to Australians, it will improve their ability to manage their own health better and reduce their demand long-term for physical care services. That is the bet that's being made in Australia and in other countries, but it's a bet that's critical to the long-term sustainability of healthcare. So a really big offer of partnership with industry to develop approaches that will help the public manage their own health and well-being with less support from costly physical health services. And at the end of all this, we are ultimately here talking about a human imperative. Whether it's in the design of cities or governments or modern health services, at the root of this is a human imperative that demands improvements in the responsiveness and personalization of public services. And in healthcare, more than many other public services, this is now a fundamental imperative, because just around the corner of where we are today, we have some revolutionary new sciences in molecular diagnostics, in genomics, and the ability to literally invite ourselves into a new conversation with our own molecules about how long we want to live and what our lifestyles should be to support that additional healthy lifespan. Yet none of that can be delivered unless health services in Australia and beyond have gone digital and are able to enable those data to be shared in real time between the patient, the citizen, and the care professional. So the obligation here is not just on us today. It's not just about our health in the future. It's in fact about our children and our children's children. And I just leave you with that thought. The reason I'm in this role, and I hope the reason we're all in this conversation, is because there could not be a more important imperative for our community at large than helping healthcare go digital. So thank you very much indeed for your time.